Well, it's almost May 15, and that is a very important day because that is when ECQ is lifted. And we will all gradually go out there in a very dangerous place, I think, with COVID-19 still floating around, with no cure and no vaccine. So the best thing we can do is to arm ourselves and give our immune system a really good boost. So for the past 2.5 months, Hayden and I have been researching a lot about what the best supplements are. And we have come up with 4 supplements that are really, really very good for you. And this is called the VB Immune Booster. Why VB? Vicki Belo. So this is really what I take, and I'd like to share this with you because I hope that it will help you. Let me explain what they are. The first thing is Zinc Picolinate. So Zinc Picolinate is a broad spectrum antiviral. So basically it stops the RNA polymerase. So it stops the virus from replicating itself. When you have a sore throat, which could be or not be COVID-19, the best thing to do is to take the Zinc Picolinate every 4 hours just to stop any invasion of your throat area. But on an everyday basis, if you're feeling really well, then you just take 1 Zinc Picolinate in the morning together with some bread or something and your vitamin C. Now, we all know that vitamin C is an antioxidant, but what we didn't know is that it works very well on the lungs. But you have to have a little something in your stomach because it is an ascorbic acid. Acid can be irritating to the tummy. But you can't take too much food with it because it might block absorption since it's a water-soluble vitamin. Water-soluble vitamins only last in the body between 4 to 6 hours. So ideally, you should take it 3 times a day. But for me, for supplementation, I think we should just take 1 in the morning and 1 at night before we sleep. So zinc and vitamin C in the morning. At night, we have to take something called melatonin. Melatonin, isn't that something to help you sleep? Yes, it is. It's something that as we get older, we lose melatonin. And so we don't sleep well at night. And if we don't sleep well, what happens? That's the only time our body can regenerate and rejuvenate. So we really have to sleep well. But guess what? They found out that melatonin has really special effects against COVID-19. It works on the cells, especially in the lungs, and it really helps with our immunity. It's anti-inflammatory. So it helps us recover. So it's so important to take this. How long before bedtime? Usually about 30 minutes to 1 hour before we want to sleep. After dinner, also with a little vitamin C. Right? Okay. And of course, the new star, the superstar of the show for immune system, it's vitamin D3. For all these years, we've kind of ignored vitamin D3, and now we realize that there is so much good that can be done by this vitamin, especially with COVID-19. Number 1, it really increases your immune system. How? Well, it creates more dendritic cells, which are like Spider-Man webs that catch the COVID-19 virus. And so it's caught, it's sticky, it cannot move anymore. The other thing that it does is it increases the monocyte phagocytosis. So it increases the Pac-Man cells that eat up all the bad stuff, and it eats up the COVID-19, again, decreasing the amount of COVID-19 in your body if you ever get infected by it. It also works very well on the lungs, especially the alveoli. It keeps the blood supply, the blood cells, the blood vessels stable, and it works on the alveoli so that you will have better lung capacity. Vitamin D is a fat-soluble vitamin, so it's important to not overdose on this because it stays in your body for a long time. So you can only take 50,000 international units per month. One of these syringes is 25,000 international units, so you only take this every 2 weeks. It's not a syringe with a needle, by the way. It's just a cute way of giving it, and you put it under your tongue every 2 weeks. And you should do it with food because fat-soluble vitamins are better absorbed with food. Well, that's it. I know with these supplements, you're going to stay healthy. Please don't scrimp on your health. It's much easier to prevent COVID-19 than it is to get it and suffer the consequences. And with this, I'm sure you guys will do a lot better and will be a lot stronger and protected from COVID-19.